Munchausen Syndrome. Does it exist? Well, let's talk about it. There's a lot of mystery surrounding an interesting and sometimes dangerous condition known loosely as Munchausen Syndrome. Experts categorize it as a fictitious disorder, meaning an artificial condition. Originally, the term was used interchangeably with all factitious disorders in the DSM, but now it is commonly used to refer to the most serious form of factitious disorder in which the individual simulates diseases and illnesses. The condition can become so severe that this behavior is the main activity and the focus of the person's life. It's their full-time thing. People who are suspected of having it intentionally create or exaggerate symptoms of illnesses in a variety of ways. Why they do this is still largely unknown, but it may be associated with an inner need to be seen by other people as sick, ill, or injured. Some people with Munchausen syndrome lie about their symptoms. They fake them. They hurt themselves on purpose to bring about symptoms, and sometimes they even alter diagnostic tests. For instance, they may contaminate their own urine sample on purpose in the doctor's office bathroom. One thing that experts agree on is that people don't fake symptoms for financial gain, like workers' comp. Okay, they're not doing it for the money. Let's talk about origins of the name Munchausen. The name of the syndrome comes from the story written in the late 1700s of Baron von Munchausen, a German nobleman who purportedly told wild and impossible adventures about himself and his extensive travels and experiences. The story was rewritten many times over history. In 1951, Richard Asher, a British physician, first described the condition in an article published in The Lancet. In it, he describes patients who displayed patterns of self-harm, fabrication of stories, and various symptoms of illnesses they did not have. Let's look at some symptoms. These are very, very interesting. What do people with this syndrome do? How do they act? What do they say? Is it easy to determine if someone is faking symptoms for attention? Well, here are some signs and symptoms to look for. Dramatic but inconsistent medical history. Unclear or uncontrollable symptoms that worsen after treatment. Appearance of new or additional symptoms after negative test results. Predictable relapses after symptoms improve. Extensive knowledge of hospitals and medical information, diagnoses, medications. Numerous surgical scars. Yes, some people actually have surgery when they don't need it. A willingness and an eagerness to have medical tests and operations. A history of seeking treatment, and a strong reluctance to allow healthcare professionals to meet their family, friends, or other providers. This is an amazing topic. I encourage you to take a look at it. I think that maybe 1% of our population may have Munchausen syndrome, so it doesn't get a lot of attention. I find it to be one of those fascinating personality-like disorders that really is not mentioned greatly or extensively in the DSM or anywhere else. I'm Dr. Jim. I don't know if Munchausen really exists. I think it does, but let's do some more research to find out. Talk to you later.